The brain, a complex mystery organ that influences everything a person does, thinks, or feels. Life after a brain injury can feel just as mysterious and complex, trying to navigate services, experiencing potential isolation, different functioning, and much more. The rehabilitation process can impact the person as well as their supporters. It's often filled with ups, downs, and everything in between, all while the brain is relearning and making new connections within. Join us as the Brain Injury Association of North Carolina sits down with brain injury advocates to discuss a variety of topics surrounding life after brain injury. The more we understand the different aspects of services and effects of brain injury, the better we can help make connections within our community for individuals living with a brain injury. This is Making Connections. Today, we're going to talk about neuropsychology and brain injury.
Hello, thank you so much for joining us today. Dr. Laurie Leach is with us here to talk about neuropsychology and what that really means. So I'm going to let Dr. Leach kind of tell a little bit about herself before we get started into our questions.
Sure. Thank you, Lauren. I'm Laurie Leach. I'm currently the Director of Neuropsychology at WakeMed Health and Hospitals. I'm also the Director of the Brain Injury Rehab Service System and our NeuroCare program, which is a low-level brain injury unit. And I'm also currently on the board for the Brain Injury Association of North Carolina.
Excellent. And can you tell us a little bit about what got you into the world of brain injury? What got you interested in the field?
Well, I've worked, like I said, at WakeMed Health and Hospitals for almost 24 years within the field of neuropsychology. So a big focus of that has been working with patients, families, survivors of brain injury. And it just kind of piqued my interest over the years. We've also had a great rehab program with a focus on brain injury, and we're a brain injury specialty program. One of the things that's been a great learning experience for me over the years is within the WakeMed system, I've been able to work with patients right after the injury, as well as working with patients years after the injury. So it's been a great learning experience about the area of brain injury.
Yeah, and I think there's something to be said for there's such a wide variety of experiences, especially when it comes to those, acute care settings. And by that, of course, I mean, hospitals, rehabilitation, any sort of emergency department, those kind of the, hospital, that's what I say when I mean acute. And then the community settings where you have more of your day programs, your residential programs, where that progress is still being made, but it may look really differently than someone in the acute setting. And so what would you say, the typical day is for an individual, for an individual living with brain injury in kind of the acute setting? And then maybe if you can touch on a little bit, I know that WakeMed sees a lot of in the outpatient setting as well. What does a typical day look like?
Sure. We actually think about it as kind of three different levels of care. What we refer to as the acute care setting is certainly right after the injury, before people come to inpatient rehab. At that point, what we know is that the earlier patients get rehab services, the better their outcomes are going to be. So in those early stages, when people are in the ICU or on just a regular hospital floor, our goal is just to get in there as early as possible to start doing therapies as quickly as we can. At that point, the focus is still more on getting them medically stable. So we're really just trying to do as much therapy as we can at that point. Once people are more medically stable and able to tolerate 3 hours of therapy a day, then they do come to inpatient rehab setting. And at that point, we keep them pretty darn busy. They have a day filled with lots of different therapies and activities. So usually in the morning, they'll start out working with their occupational therapist, focusing on things like bathing, dressing, kind of those simple skills for everyday living. Typically each morning, they'll see the physician will come around as well too, just to check up to make sure that their rehab program is going as planned. Then throughout the day, they'll get physical therapy, speech therapy. They may see a rehab psychologist, they may see a therapeutic recreational specialist and a neuropsychologist. So it's a pretty busy day, really focused on helping them get better as quickly as possible. Once they go home, then most patients do engage usually in a day treatment program or an outpatient therapy program. Usually then what the focus more is on helping them getting back to sort of their usual activities, and the focus is really on life is therapy as well, and trying to get them back to as much of their normal activities as they can.
Excellent. Yeah, it definitely sounds like they're really busy, and there's a lot a lot of progress to be made. I know I've seen in the rehab setting specifically, and you mentioned how people should get treatment as early as possible. What can you say, if anything, about that kind of notion about how people only make progress within the first 6 months to a year to 2 years? Is there anything you can say about, that kind of, I would say, myth when it comes to progress after a brain injury? Because I know that you guys do rehab reunions, you have peer supporters coming in. Would you say that that is true, that progress only happens for a short amount of time?
No, that's definitely not true. I think what we tell family members is usually within the first 6 months is when you really see the leaps and bounds and improvement. So that's when you're kind of comparing recovery from day to day. They couldn't do this yesterday, but now they can do it today. But certainly we know that the brain continues to heal and recover for a longer period of time. Usually the research goes up to about 2 years, but it's likely longer than that. And that further down the road, that's when we usually, help family members say, don't look so much as progress from day to day, but look compared to what they were doing a month ago to what they're doing today. So yes, we know brain injury recovers continues well past the 6 months.
Excellent. Yeah, thank you. And I know that one of the big components of progress and looking at the effects of a brain injury is really kind of where neuropsychology kind of fits in, right? So, what is neuropsychology and how is it used for individuals with brain injury?
Well, neuropsychology is really a subspecialty of clinical psychology, but we really focus more on brain behavior relationships. So, in other words, understanding really how the brain works and how that influences our functioning, both our physical skills or thinking skills, as well as our emotions and behaviors. So, for individuals with brain injuries, neuropsychology is important just because early on in the hospital, there can be so much going on medically. People are fatigued, they're on lots of different medications, they're stressed, there's just a lot going on. And sometimes it's hard to pick apart what's all those other factors versus what really is the brain injury. So early on, doing some screening of cognition can kind of answer that question a little bit better. These are the areas that they're having deficits that we think are probably due to the brain injury, versus this might just be the medication making them a little bit slower, a little bit more fatigued, things like that. Down the road, after further recovery time, neuropsych assessment really then takes a lengthier battery of tests that really, again, give us a better sense of thinking skills, behaviors, and emotions, and how those might be changed due to the brain injury.
Excellent. And so you kind of touched on, how it's a very large test, right? There's a wide scope of things that it covers. Can you elaborate any more on, what the scope of the neuropsychological assessment is? How are they really used in the acute setting versus the rehabilitation versus community setting? Do you have anything to elaborate on that?
Sure. In the acute care setting, really, it's more of a just screen, because people usually are changing so rapidly at that point that it's hard to do a big battery of tests. So every hospital probably does it a little bit differently, but for our hospital, essentially what we do is just kind of have a conversation with people about how are things going? What feels different to you? Getting a little bit of background information about the individual from them and from their family. And then just doing a few tests that really just kind of put their brain to work to get them a good sense of their thinking skills right now. A lot of the focus early on is really education about brain injury. So we may do just very short, limited testing to get a good feel for how they're doing, focus on educating the individual, educating the family about how they're doing and kind of what to expect for the future. After they're out of the hospital and home and then ready for a more comprehensive battery of tests, then we do several hours of testing, which can be pretty tedious, but unfortunately there's no easy way around that. And the focus of that battery of tests is really, again, to tap into all the different thinking skills, memory, language abilities, spatial skills, executive skills, things like attention, concentration, speed of thinking, all those different abilities. What we do then is compare the testing from the individual to a normative sample, so people that are the same age, same educational background, to get a good objective sense of their thinking skills. Everybody has their own strengths and weaknesses as well too, so we try to take that into account when we do the testing and really look for a pattern of change that is consistent with the type of brain injury that they have. And then the goal of the testing is really to help the individual understand the changes in themselves a little bit better, help them kind of plan for the future, help them kind of develop some strategies to compensate for any areas that might still be a weakness at the time that we do the testing. We also send then a more formal report that can go to the treatment team and the physicians working with that individual, and that kind of helps guide decisions about getting back to work, school, or other usual activities.
Yeah, I know that there's a lot of people that maybe go through the system and they get this neuropsychological evaluation, but they're not really sure what to do with it. It's a very large, almost like a binder, it feels like, a lot of pages, because there's a lot of information that you guys capture with neuropsychology and all those tests and what they're looking at, et cetera. And so what can people really do? You know, you mentioned a little bit about what happens after the neuropsychological assessment takes place, right? You guys give certain strategies, give the information to individuals. You know, what can family members and individuals living with brain injury really do with this information, or what should they know about neuropsychology in general?
Well, I think the report sometimes can be technical and not always geared for the patient and the family to take a lot from, but a lot of the recommendations hopefully are geared specifically for the patient and family. But usually the neuropsychologist will kind of talk with them about that and give them a lot of verbal information about that and help them develop either compensatory strategies, help guide them to resources that might continue to help them in their recovery. And a lot of it too is to help people understand how they're different, because sometimes people that have a brain injury can lack some awareness or understanding of how their brain is differently. So a lot of the focus is helping them understand their brain injury a little bit better as well too. But like you said, the report itself can be pretty long. So it's good for anybody just to hold on to those records and kind of keep that information for themselves. And then usually we'll reevaluate people over time as well too. And so that's good to have that old testing as a comparison for improvement or change over time.
We'll be right back.
Neurocommunity Care is an independent case management and community support provider specializing in community-based support services for persons with brain injuries and other neurological conditions. Our services are provided in the individual's home or community and are functionally based. This translates to real-life skill development, improved quality of life, and increased independence. If you would like information on how Neurocommunity Care can support you or your loved one, reach out to 919-210-5142.
Yeah, I definitely think it sounds like those type of things are something that's really good if you're meeting a new provider or anything. As you mentioned, it's kind of written for, it's very tedious, but a lot of professionals, when they're, within a provider, they're looking for that neuropsychological assessment because they want to kind of have written down on paper that clinical assessment to see where they are, maybe where they progress. And I think I know one of the things that we recommend is people holding on to that neuropsychological assessment, storing it somewhere just in case you might need it later, even as because it does a little bit of almost like diagnostic function as well, whether or not someone maybe has never been had diagnostics for a brain injury or had brain scans done. Maybe it was an injury that happened many years ago, and it was never really addressed. And so it can also serve as a diagnostic factor as well. Is that correct?
That's right. Yep, exactly. We usually try to go through old records, make sure there's a lot of detailed information about their history to really help them moving forward as well, too.
All right. And so I want to, it definitely sounds like the neuropsychology is a really very large and important field when it comes to brain injury, but I find that a lot of people are not as aware of its function and things like that. So I greatly appreciate, before we talk a little bit more and switch gears on just like the rehabilitation process and what you've seen there at WakeMed, is there any other comments that you have for our professionals, for anyone about neuropsychology and its importance or its function?
Well, I think we covered it pretty well, but I think you're right that there is a lot of misunderstanding about what neuropsychology is. And sometimes people just confuse it with kind of regular clinical psychology, that a lot of the focus is on just mood, coping, things like that, which are all very important. But the key difference with neuropsychology is really understanding how the brain is working differently. So neuropsychologists have a extra degree of expertise of how the brain works, and when it's injured, how that can affect a person in a variety of ways. So I think understanding that difference is pretty key. It gives a lot of important information to really guide medical care and ongoing treatment, as well as just education as people move forward in their recovery.
Perfect. So as I mentioned, I kind of want to turn into the rehabilitation process just to finish us up. One of the big things that I know that I see when I'm going into the hospital and things like that is the importance for education of family members. I'm seeing a lot of tired, individuals, a lot of people that are just experiencing this for the very first time, this whole rehabilitation process. What role do family members and supporters play in rehabilitation, and what does that really, like, that transition from just, normal life into rehabilitation look like?
Mm-hmm. And you're right, the social support that someone gets from family and other loved ones is pretty critical in the rehabilitation process. And research does really show that the more social support that someone has, likely the better their outcomes are going to be. It's a challenging time for family members, and we certainly recognize that. I think in the early days, when someone's still in the ICU or just a few days after their injury, family members are usually there all the time. The challenge, I think, there is really just giving them education without overwhelming them, which is always a challenge for us. We try to give them lots of information, but at a rate that they can kind of use it and understand that. Once a patient with a brain injury is more stable and gets to the inpatient rehabilitation stage, often that's the point where we're really encouraging family members. They're here at rehab, we've got them, we're going to take good care of them. This is a good time for you to go home and really get your rest and take care of yourself, take care of other things that need to be taken care of. Because once that person comes home from the hospital, then your caretaking role, your caretaking activities are going to increase. So really make sure that you're taking care of yourself during that time. Once they're home, then, for family members, it takes on a whole new, different new normal for them as well, too. A lot of what we encourage family members at that time is really develop as much a routine as you can as possible. the hard thing about recovery from brain injury is that there's no specific time frame for how someone's going to improve and get better. So you really have to kind of just take it one day at a time, and having some routine and structure to the day helps the survivor, but it can also help the family member cope a little bit better from day to day as well too.
Excellent. And so you mentioned a couple of times, that transition almost, we're almost talking like about brain injury services into two separate categories, almost, you're in the hospital and then you're home and then you're in the community and things like that. Where would you say either professionals can help with that transition, or how can services help as a whole, just if you want to be a little bit more broad about it, to be able to support individuals that are making that transition from the new unknown to the vast unknown of community living after brain injury?
Mm-hmm. Well, I think that's a tough question, and there's no easy answer. Like I said, a lot of it is education, and families are at different levels of being able to really take advantage of all that education while they're here in the hospital. So what we try to focus on a lot of times is having written materials and resources. So our case managers, I think, do a great job of making sure that they've got contact numbers, information for Brain Injury Association, any other resources in their community, and that they can kind of reach out to them as well too. But it is a tough transition, and I think we just try to stay connected with families as much as possible, and really encourage them to get involved in the brain injury community, just so that they can be in touch with those resources as they need them.
All right. And I think that's all of my questions. I greatly appreciate your knowledge and your experience in the field and your dedication to brain injury, which I've been able to see for a couple of years now, and I've had the privilege to work with you. So I really appreciate taking the time to do the interview today. Is there anything else you want to leave us on? Or I think we covered a lot about neuropsychology, acute and community care settings. So, but if there's anything else you'd like to share.
No, I think we covered it all. The only thing I think I would add is just, part of that recovery is that there's so much unknown, and really families need to kind of focus on the little successes when you get home as well too, and try to celebrate the little things rather than focusing too much on the losses. And that can be a tough change, but I think something that the Brain Injury Association does a great job of as well too.
Excellent. Well, thank you so much. I really appreciate it, and I look forward to speaking with you soon, and I hope that everyone watching got a great information. If you have any questions or ideas or anything about additional videos or questions for a neuropsychologist or Dr. Leach, please contact the Brain Injury Association of North Carolina, and we can get those answered. Thanks so much.
Thanks.